There's a question that echoes in late night searches and quiet barbershop talks. If I masturbate every day, am I hurting my prostate or helping it? I'm urologist Alarain, and today I'm going to tell you the part nobody explains clearly. No scare tactics, no moralizing, just what the best evidence suggests, so you can make smart choices for your body. First, a quick map of the territory. The prostate is a walnut-sized gland below the bladder that helps make semen. As we age, it can become tender, inflamed, or enlarged, BPH, and that affects how we pee, how we sleep, and how confident we feel. Understandably, anything that might change prostate risk gets huge attention, especially daily ejaculation. Here's the shocker. When researchers stopped guessing and actually measured the data, the myth flipped. A large Harvard-affiliated study, following roughly 32,000 men over many years, found that men who ejaculated more often tended to have a lower risk of prostate cancer, on the order of about 20 to 33% lower for those in the highest group, around 21 plus times per month, versus those in the lowest group. That's correlation, not destiny, but it's consistent with other research, and it should calm a lot of anxiety. Why would that be? 3 leading ideas. Prostate stagnation. Hypothesis. Regular ejaculation may help flush ducts and old cellular debris. Healthier cellular turnover, more frequent release, may support a cycle of clearing older cells and making room for newer, healthier ones. Stress-inflammation connection. Ejaculation can reduce tension, and chronic stress is linked with inflammation, a known driver of many illnesses. Quick favor, if this helps, tap like, share with a friend your age, and consider becoming a channel sponsor so we can keep this evidence-based. Now, the reality check. Frequency alone is not a magic shield. What helps your prostate the most is a bundle of smart habits you repeat over time. Food that fights inflammation, tomatoes and watermelon, lycopene, leafy greens, cruciferous veggies, berries, olive oil, nuts, and fish rich in omega-3s. Move daily. Aim for 150-min week of moderate activity plus 2 strength sessions. Strong legs, hips improve pelvic blood flow. Pelvic floor practice. Kegels for men, slow controlled squeezes, not brutal reps, improve circulation and bladder control. Sleep 7 to 8 hours. Testosterone and repair mechanisms take a hit when you cut sleep, and so does mood and erectile quality. Alcohol and smoking. Less is better. Both are linked to worse vascular and inflammatory profiles. Here's a performance tip most men over 50 never hear. Slow down and change the technique. Older tissue responds better to gradual arousal, steady breathing, and full body engagement, legs, glutes, abs, than to fast, high friction. Use a quality lubricant and vary pressure to avoid desensitization. Think circulation and comfort, not just speed. If you're curious about safe, at-home ways to support nitric oxide, the signal your blood vessels use to relax and carry more blood, check the top pinned comment. You'll find a science-minded option that combines natural nitrate sources to convert into nitric oxide, key amino acids to help maintain steady NO levels, and antioxidant compounds that support nitric oxide synthase. Many men also report clearer focus and an overall lighter vascular feel. If improving energy, stamina, and healthy circulation sounds useful, open the link in a new tab and keep watching. There's more you can do starting today. Before we move on, drop a quick comment with the next men's health myth you want tested. Thank you. Now let's handle the right now stuff. If you're waking to pee, feeling a weak stream, or never fully emptying, try these easy wins. The double void, finish, wait 30 or 60 seconds, lean forward, and try again. Gentle abdominal engagement helps the bladder contract. Cycling fix. If you bike, use a noseless or center cutout saddle and padded shorts to reduce pressure on the perineum. Bladder training. Extend intervals between bathroom visits by 10-15 minutes each week. Don't just in case pee every hour. Anti-constipation rule. Daily fiber, 25 to 35 g, and water. Constipation worsens urinary symptoms by increasing pelvic pressure. When to call your doctor, no waiting, burning with fever, blood in urine or semen, sharp pain in the perineum, difficulty starting a stream that suddenly worsens, or urinary retention. Also, talk with your clinician about PSA screening in your 50s. Earlier, if you're black, have a first-degree relative with prostate cancer, or carry higher genetic risk. Screening isn't one size fits all. Make it a shared decision. Daily erection and performance support without gimmicks. Circulation first. Walk after meals. Do 20-30 minutes of cardio most days and train legs twice a week. Blood flow follows muscle demand. Nitric oxide foods, beets, arugula, spinach, pomegranate, citrus, garlic, and cocoa. Combine with adequate protein and minerals. Zinc, magnesium. Breathing pattern. In through the nose for 4, out for 6. During arousal, this keeps your nervous system out of fight or flight, which sabotages erection quality. Pelvic floor. Relax first, then squeeze. Release tension on inhale, light squeeze, and lift on exhale. 5 to 10 controlled reps, twice daily. Technique rotation, vary angle, grip, rhythm, and include full body touch. Lower friction, longer runway. Comfort equals better circulation. Food lifestyle caveat: spicy foods, very acidic drinks, and late heavy meals can irritate the bladder for some men. Track triggers for a week and adjust timing rather than eliminating favorites. If this helps, tell me in the comments which habit you'll try. If we've saved you time or stress, a quick super thanks keeps us going. About that big Harvard result, it doesn't give permission to ignore the rest of health. Think of ejaculation frequency as one powerful lever among many. Stack it with better food, movement, sleep, stress management, and regular check-ins with your clinician. That's how you build a resilient prostate and a strong life. And hey, if you learned something that takes the fear out of this topic, please like the video. It signals to YouTube that this conversation matters. If you want to go further, become a sponsor or send a one-time super thanks so we can keep building this library for men over 50. Disclaimer, please listen fully. I am an AI urologist who summarizes research and reputable sources to make men's health clearer. This content is educational and not medical advice. Do not start or stop any treatment based on this video. Always consult your personal physician or urologist about your specific situation. Subscribe, join us,